This episode is brought to you by Arthrex. Arthrex is a global medical device company and leader in multi-specialty, minimally invasive surgical technology, along with scientific research and medical education. The company has pioneered the field of arthroscopy in sports medicine and develops more than 1,000 new products and procedures annually to advance minimally invasive surgery for orthopedics, trauma, and spine, in addition to arthroplasty, cardiothoracic, and biologic innovations. Today's focus is on ultra-minimally invasive endoscopic spine surgery. Endoscopic spine surgery offers several advantages over traditional spine surgery, including a faster recovery, fewer postoperative complications, and smaller incisions that help prevent damage to major muscles. Arthrex is a leader in this field with a comprehensive portfolio of innovative tools. So whether you're in healthcare, curious about cutting-edge tech, or just grateful to walk pain-free, check them out at arthrex.com. That's ARTHREX.com. Arthrex, helping surgeons treat their patients better. Welcome to the Birmingham Medical News Ask the Doctor podcast. I founded the newspaper 20 years ago. It's a newspaper it's a monthly newspaper that goes out to all the doctors, nurses, health care executives in northern and central Alabama. But we also have a digital edition. And if you'd like to subscribe to our digital edition, there's no charge. You can email steve@birminghammedicalnews.com and we can put you on that. We don't spam people. We just send out the issue once a month. We've been doing this podcast for about a year, and we're only actually able to do this because of Kassouf & Company. Kassouf & Company is a great accounting firm. We've had a partnership with them since the very first issue of the newspaper. They have been around for almost 100 years. They've got full service accounting, but they also have a wealth management arm that is really experienced. And for our purposes, what we're really familiar with, they've got a first-class healthcare management team. Today we're going to be talking about spinal endoscopy, and our guest is Dr. Hossein Aziz. He's an orthopedic surgeon here in Birmingham with OrthoSports Associates. And I got his background, and I was going to talk about it, but I was more interested in hearing from Dr. Aziz. So you tell me, start in New York and tell us about yourself.
Sure, yes. So I grew up in upstate New York in a small town called Pittsburgh, New York. It's a small, quiet, beautiful suburb. Went to high school there, then went off to college in the same city at the University of Rochester. One of my best friends had moved out to San Diego, and I kept in touch with him. He's like, hey man, you gotta come out to San Diego, it's awesome, you're gonna love it. And so I was like, all right. So I applied to grad school out there and enrolled in public health, studying epidemiology, and really fell in love with Southern California. And then found my way up to start medical school there after grad school. And still found an excuse to stick around and went to residency there for orthopedics.
Okay.
And then fellowship, so I do orthopedic surgery but subspecialize in spine. Fellowship brought me out to Birmingham over here at University of Alabama, Birmingham, where I really had a fantastic time training and learning spine surgery there. And
you didn't think about going, after you got your fellowship, you didn't think about going back out to Southern California?
Yeah, we did some. You know, my family is from Southern California, and we definitely feel the draw to go to stay out there. So.
Okay. One last thing before we get to it. It's interesting. I only learned a few minutes ago that you did originally a post-grad in epidemiology, and
yes,
that's
sir.
Really interesting after COVID.
Oh yeah. So you know, I think when I was studying epidemiology, it was much before COVID, but really,
of course.
But when COVID hit, you know, really seeing how decimating of a disease that was, through that public health lens was really interesting.
Yeah, I can imagine. Well, anyway, so obviously we're talking about spinal endoscopy. A lot of our listeners are going to be healthcare professionals who know all about it, but we're going to have plenty who don't. So with that in mind, can you kind of just tell people what it is?
Sure, yeah. So spinal endoscopy is like the ultimate in minimally invasive spine surgery.
Okay.
So through a small incision, often less than a centimeter, using a tiny camera called the endoscope. I actually have one right here. So this is an example of endoscope, very, very small.
Okay.
And then you insert it through that incision. and it allows you to visualize the spine in high definition 4K.
Okay.
And then through that same scope, you can insert small tools and really work on the spine safely in real time and remove whatever kind of pathology or disc material or overgrown tissue is irritating the nerve.
Where is the endoscope going in?
Yeah, so it depends on which area of the spine you're working on and whether it's upper back, lower back, or middle back. It also depends on which approach you're trying to use. One of the really nice parts about spine endoscopy is there's many different utilities for it. But usually it's either going to be off to the side of the back or directly midline.
Okay, interesting. So you've got I guess a video monitor there.
Yeah.
And okay, that's very interesting.
Yeah, and once you put the scope down, there's a camera cable that connects fiber optic, and then it projects onto some television screens, and you're watching what you're doing in 4K real time up on the screen. Yeah, so that first slice, you can see right there where that red rectangle is. That's the nerve root being pinched by some bone and some ligament from the back, and then some disc material from the front. So what we did is we went in there endoscopically using some of those tools that I showed.
You want the next slide?
Yes, please. Thank you. And so there in that top left picture, there's some disc material and some bone covering up the nerve root. And that picture right next to it, you can actually see that grasper. That's under the magnification of the camera. It looks a lot bigger there, of course. And then I'm removing some disc. And as you can see, that white long cord is the nerve root. Before, it was completely covered up by disc material and bone, and slowly working away to safely free up that nerve root. And those last shots show that I've completely freed up that nerve root. And this patient did fantastic, very, very satisfied. Her leg pain went away. That's the size of the incision, so just about a centimeter there. So super small, and then you can just cover it up with Band-Aid after surgery on the screen. That's really cool stuff, very, very neat.
And what, you may explain this in a minute, I'm not sure, but what, like, okay, what would be a condition in the spine you'd be looking at, and what do you actually do?
Yeah, so there's a whole bunch of conditions, and depending on what the offending problem is, that's going to determine what you do. So if it's some disc material that's pushing on the nerve, you're going to get in there and use some small instruments and remove that disc.
So that's a disc is that a disc that's just degenerated? Or how's that?
It could be either. It could be a disc that's kind of squirted out with an injury. It could be a degenerative disc that's pushing on a nerve. You can also remove overgrown ligament and overgrown tissue if it's pushing on the nerves. There's all sorts of utilities for it. Interesting. So, all right, and I know that apparently it's really grown in use a lot in last recent years. How is it different from traditional spine surgery? Yeah, so the main thing is the size of the incision. So classic open spine surgery, you've got usually a pretty generous size incision. You're going through muscle, you're taking away bone, you get bleeding. So bigger incision means more pain, more blood loss, higher risk for complication, as compared to endoscopy, which really your incision only needs to get you this camera down, so it's tiny.
Are you not? Would you be going through muscle with this as well?
You
or
do,
not?
but you're just kind of
very
spreading,
small, right?
A very small amount. You're just kind of spreading through it more than peeling it away or cutting it.
Okay, wow.
Yeah.
Because I'm sure cutting it, that's got to be rough in terms of rehab.
Definitely.
Because the muscle's got to regenerate.
Absolutely, Steve. You're right, and you get a lot of spasms afterwards too when you peel muscle away and it reattaches, or if you have to cut muscle.
Okay. So that's the main difference then, obviously.
Yeah.
How would you kind of compare the benefits of spinal endoscopy to the traditional spine surgery?
Benefits are numerous. The patients get up walking faster. They rarely stay in the hospital overnight. Normally it's a same-day procedure. You head home the same day.
Oh, that's okay.
Oh, it's great. Time to recovery, time to getting back to work, time to getting back to your social life, time to getting back to working out. That's all cut down drastically with spine endoscopy because the trauma to the body is so much less. It's truly the ultimate and minimally invasive for spine.
Well, and somebody has traditional spinal surgery, how long would they be in the hospital?
Depends on what the procedure is. Sometimes a few days, sometimes 1 or 2 days.
And I'm sure the recovery's got to be time's got to be totally different.
Oh, definitely, absolutely.
Yeah.
If you're going after a disc herniation with endoscopy, sometimes these people can get back to work in a few days. With the classic open approach, especially if they're a laborer or doing a lot of heavy lifting, they may be looking at 4 to 6 weeks before you're back to work.
Oh man, so that's a big difference.
Oh yeah.
Is that the main benefit, the recovery and the, I guess, lack of trauma to the
It is.
muscles?
Yeah, and another neat part
Yeah.
about it is it offers you a novel approach to the spine. So you can go from the side of the spine to get to where the nerve root exits out
Okay.
with endoscopy, and deal with any problems there. Remove some disc material, remove some ligament, remove some bone. Classically, if you were doing that through an open approach, you would have to cut some bone to get to that area.
Oh man,
And that
okay.
destabilizes the spine and sometimes necessitates a fusion. We're using screws and rods. So often that this technology can help you avoid a fusion.
And so that's seriously, I mean, it's not just, it's a really less invasive.
Absolutely. Definitely.
Yeah. So, all right, what when you see patients who come in, what are the indications that would point towards spinal endoscopy?
Because there's so many different techniques, really can treat almost all pathologies of the spine. So neck pain, lower back pain, pinched nerves, recurrent disc herniations, spinal stenosis, pain running down from the neck into the hands, or pain running from the lower back down into the legs. So there's a whole gambit of spinal pathologies you can treat with endoscopy.
So it sounds like, does that mean there's almost, is there ever a reason to use traditional? It sounds like you could almost treat anything with spinal endoscopy.
It's not so much a one size fits all. There's really no, I think in surgery in general, or even in medicine in general, there's rarely ever a one size fits all. Certainly if a patient's not healthy enough to undergo a procedure, right, they wouldn't be a good candidate. If they've got a big curve or big deformity or scoliosis, perhaps a larger open procedure may be better for them. And so it has a tremendous amount of application, but there still are some niches and some utilizations for traditional open spine surgery.
Okay. So what of the various folks who come in, who are the best candidates?
So I'd say the best candidates are people that have tried conservative treatment, right? They've tried some physical therapy, they've tried some medication. They're having pain that interferes with their daily life. They can't go out to the grocery store, they can't go to work, they can't exercise because of the pain. And those are really the best candidates for it.
And can it be used as an alternative to delay a fusion?
Definitely, yeah. It can be used to delay a fusion for sure. And it's kind of like we spoke about earlier, you can even avoid a fusion completely. Those are some of my most satisfied patients and some of my most satisfying procedures, knowing someone that have got them better and have avoided a fusion, whereas before endoscopy was utilized, that person would have gotten a fusion. So it's a good feeling both for surgeon and patient.
So let me ask you this. So if you would walk us through the procedure step by step.
Sure. Yeah. So the patient comes to the hospital, checks in with the anesthesiologist and the nurse, roll them into the OR. They get put to sleep. And then we use X-ray to target the area where the problem is. After we do that, then you insert the small camera right at that level of the spine. Then you're looking up at your screen and you start sliding some of your tools in and out to be able to deal with whatever the problem is. And I actually have some of them here. And they're super tiny, which is a good thing. So here there's a small grasper or pituitary, for example. You could use this to remove disc that's pushing on the nerve. And really can use it for very delicate work. Here's an example of a nerve hook, and you can use this to clear away.
You said a nerve?
A nerve hook.
Yes,
you can use this to clear away tissue or gently manipulate the nerve as well. So use those tools while watching exactly what you're doing in high definition.
And by the way, the first tool, in the middle there.
Yes.
You call that the grasp?
It's a grasper or a pituitary. Yeah.
And so it looks like a tiny little, boy, so what would you be like, I hate to say it, grabbing with that? I mean,
so like if some disc material, for example, is pushing on the nerve, you could use your nerve hook to really tease away to separate the nerve from the disc. And then once you've done that safely, then you can use this to remove the disc that's pushing on the nerve.
God, that's got to be. I mean, is the disc that small? Because that's a tiny little.
Yeah, often they can be,
Okay.
And even with larger disc herniations, you can take it out piecemeal using this.
Okay.
But often the amount of disc pushing on the nerve is not large.
That's amazing. I mean, I've never actually seen surgical tools, and as you were showing those, I was thinking, man, you've got to really be, you've got to be really, what's the word for it? I guess
Dexterous.
Dexterous. Yeah. Thanks.
Sure. One of the other cool parts about endoscopy too is you can take pictures during it, right? So
Okay.
then I can show the patient afterwards and their family,
Oh,
hey,
wow.
here's what we did, here's that disc that we got that we removed from
Okay.
your spine. So that's really satisfying too.
Very nice. I mean, if you're a patient, you'd feel much better seeing exactly what was done.
Definitely.
What kind of anesthesia? Oh, I'm sorry.
Yeah.
You mentioned sometimes, I think it's a rare occasion, though. You mentioned sometimes you may do it with patient awake. Or
Yeah, sometimes we can do it with the patient awake, but often it's normally under general anesthesia, so
Yeah.
you're completely asleep.
Right.
And don't feel anything, and you wake up and the surgery's done.
And how long does it take?
It depends on the kind of procedure
Okay.
and how severe the problem is,
Mhm.
but a rough window between 30 and 90 minutes.
Okay, so very short, very
Mhm.
short. How about the recovery? How does I know we talked a little bit earlier about how it compares to traditional.
Yes. Recovery is so much faster. It's like night and day. So after surgery, you go to the recovery room.
Mhm.
They watch you coming out of general anesthesia, make sure you're safe. Then you
Mhm.
get up, walk around, use the bathroom, and then you're good to go home.
Mhm.
Usually, the incision is so small that it's just
Mhm.
one small absorbable stitch, and I put a Band-Aid over it.
Okay.
So as far as recovery with dressing changes, anything like that, there's nothing involved with that.
Mhm.
You can shower the next day, which is wonderful.
Yeah.
For my active patients that really want to get back into the swing of things, I let them slowly ease into light activity and hopefully back into their full routine by about 2 to 3 weeks after surgery, full routine. Whether that's labor, working out, and more physically intense things. I had a patient last week that we did spine endoscopy surgery on, and before he said, Doc, I've got my sister's nursing graduation the next day.
Mhm.
I've got to make it. I was like, well, it might be cutting it close, but
Mhm.
we can certainly try. I called him the next day. He went to his sister's nursing graduation, or it was her pinning, and he was just so happy about it.
That's
So-
great.
And that never would have happened with traditional open spine surgery. No way.
Yeah, that's fantastic. Is there much of a rehabilitation? Do you have to?
Yeah, that's a good question, Steve.
Okay.
It kind of depends on the patient. It depends on what
Okay.
the problem is.
Uh-huh.
But it's a whole range of things. It could be something as simple as just a home stretching program or
Mhm.
exercise program,
Mhm.
or something more involved as regular physical therapy with a specialist.
Okay. And I know that spinal endoscopy is not brand new. It's been around, but it sounds like technology has changed to where it's really kind of exploded.
Definitely, yeah. It seems that they're coming up with new techniques almost every month. When you go to
Mhm. Oh, wow.
conferences, someone's up there describing a new technique. Hey, I was able to do this. And a lot of that is from the advancement in the quality of the cameras. Having 4K high definition cameras, you can see things in amazing quality and detail. The angled optics have come a long way, so you really can see around much better. Even some of the tools that we use have been advanced, all in the name of patient care and patient safety too. It's really amazing the leaps and bounds endoscopy has taken.
And so, are there any kind of published success rates?
Yeah, so the published success rates are well studied. It's between 85 to 95% good to excellent results. So really high quality, and the complication rates are very, very, very low.
And what about after the procedure? How soon will the patient notice an improvement in his or her pain?
Yeah, so it depends on the patient. See, some patients wake up and they're like, did I even have surgery, right? I feel great, I feel fantastic, my leg pain is gone. That's very satisfying. Other times it may take even a couple weeks, a few weeks to realize the full benefit. But relatively speaking, that's a quick turnaround.
Okay. And if you've got a person, what advice would you give to someone who's got, back or leg pain, and they're trying to consider whether or not to do something like this?
Sure. So my advice would be to seek out an expert that's trained both in traditional open approaches and minimally invasive surgery like spine endoscopy. That way you're getting the best tool for what you have. That would be my advice. And also to make sure that you've tried everything else, conservative treatment like physical therapy or maybe even some injections first before even undergoing surgery.
Well, that sounds great. How would somebody in this situation find a surgeon?
Yeah, that's a good question. Word of mouth, right? If you have a friend that went to someone or a family member that went to someone that they trust, that's always a good way. You can always just call up the doctor's office or check their website too. If someone is really doing a lot of spine endoscopy, their staff should be familiar with it, or the website should talk about it too. Or always just make an appointment and go see your surgeon and ask them, hey, do you do this? And if not, they should be able to refer you to someone that does.
Well, that sounds great. Is there anything we should add or sum up?
Honestly, it's just super exciting technology. I take a lot of satisfaction of seeing people get better quickly. So I've just really fallen in love with endoscopy. I think it's an amazing technique. I think it's revolutionizing spine, and it's a game changer for sure.
Fantastic. Well, thanks a lot for coming to see us, and I've learned some pretty interesting things.
Great, good.
Yeah.
And I'd like to give a special thanks also to you, Steve, and Birmingham Medical News, and also Kasuf for really appreciate the opportunity, as well also to Arthrex for supplying some of the instruments here for our demonstration.
Well, it was our pleasure. We're glad to have you.
All right, thank you.
Thank you for listening to today's episode of the Ask the Doctor podcast, brought to you by the Birmingham Medical News and Kasuf & Company. Please make sure to like and subscribe, and make sure to tune in for our next installment. I'm Steve Spencer, and wish you and your loved ones a healthy journey until we see each other again.